Bismillahirrahmanirrahim. Now we are going to discuss the brachial plexus. The main segment in locomotory or musculoskeletal system, we discuss two or three segments are most important. You need to study. One is the nerve supply. Other is the your muscle function. So the question comes like this: this nerve is injured, what will happen to the which muscle will be affected? This muscle is not working, which nerve is injured? So the question comes like this. So your 50% questions are come like this, and their function, and the second part is the pathology. If not working, that is pathology. So actually we are discussing the brachial plexus, that is actually nerve supply of your upper limb. So coming to before that, what are the segment we have to cover? So brachial plexus, we will discuss their different components, their course and major function. So if you cover this lecture, almost if you spend good time with this, your 50% job of upper limb will be covered. Okay. So coming with the brachial plexus is actually innervation. So if you look at the spinal nerve, there are 31 pairs of spinal nerve. So if you look at throughout the spinal nerve, you find at two level majorly. One is at cervical level, two plex formation here. Plex is actually network of nerves. So because when your spinal nerve comes, so their ventral remain and the dorsal. The dorsal go to the back, supply the back of your body. The ventral comes in front and form a network. That network function is that's job is to supply your upper limb. The name of that we use brachiate for the R. So that's why the plex name is brachial plex. Other plex formation is cervical, and you when you discuss the lower limb, you discuss the lumbosacral. One is lumbar plex, other is the sacrum. So you can see here, so different nerves coming here and form a network. So that is your brachial plex. While if you look at here, lumbar region, so lumbosacral plex formation occurring here. Lumbosacral plex formation occurring here. So if you see here in the thoracic, you see just nerves are coming. There is no plex formation here. So directly coming. So these are thoracic nerves. You see two plex right here at the lumbar sacral region, two plex right here in the your neck region, or you can say cervical region. Okay. So you have seen the two plex cervical and brachial at the cervical region, and two plex right in the lumbosacral, which we discuss in the lower limb, and the brachial plex associated with your upper limb, and which remain ventral or dorsal. This is the question. Ventral remain is involved. Dorsal do not involve in the plex formation. They go back and supply the back of your body. So we are coming to the 5 points we actually discussed in the brachial. So first the root comes, then the trunk comes, then you see the division that called. So I have couple of mnemonic created which will help you. Before that, just understand the basic idea. What is how the brachial plex formation is occurring? Just see. So your 5 nerves are involved. Your C5 segment, this ventral remain, C6, C7, C8, and T1. So these are actually your root. So they are going to form. These are actually 5A number. They form 3 trunk. So let's see how their formation. C5 and C6 coming and forming 1, and C7 single. So what you have seen? You have seen 3 trunk formation. One is superior, one is middle, one is inferior. You can see only this is a question. Is an MCQ. Which trunk is formed by only single root. That is your C7 is middle by only C7, while these are by C5 and 6. So superior, middle, inferior trunk. Easy. So now each trunk divided into 2 division. One is interior, one is a posterior division. So let's see. So here is 2 division. Here is 2 division. Here is 2 division. One is interior, one is your posterior. One is interior, one is posterior. Interior, posterior. What you have seen? You have 6 divisions, 3 trunks, 5 roots. So now see all these the 6 division. So all the posterior division, they unite and form cord, that is the posterior cord. Posterior cord formed by your all posterior, while the interior formed toward the lateral and medial. So let's see how they form this. All the posterior segment unite and form a single cord, that is your posterior cord. And the interior, these three interior, one, we have three cord, we have three trunk, three cord. The lateral cord which is formed by these two, and you have medial cord formed by this single interior. So interior form two cords, posterior form the single cord. Let's see how the formation is. This is posterior division of from this one, and here is posterior, here is posterior. They are united and form the your posterior cord. Now see the other two cords. So we have three cords. This interior and this interior. They form other cord, that is your lateral cord. Okay. So the single one only remaining, that form the your medial cord. Why are we calling them the lateral, posterior, medial? The reason is that they are present in the your axilla region. So when you discuss the axilla content, you also discuss these. The posterior cord is posterior to your axillary artery. The lateral cord is lateral to the your axillary artery. Your medial cord is medial to the axillary. So these are relation of your axillary artery actually. Axillary artery is actually supply of your upper leg. Okay. So these are relation with that. So these are called, now there are 5 major branches. So let's see. This give the your musculocutaneous. Other give the posterior give the axillary and the your radial. While your medial give your ulnar. We have 4 discussed. The 5th one is formed by the lateral and medial both. Let's see. So medial coming here, lateral coming here. They form other, that is your medial nerve. So the first thing is the you need to know we have 5 segments in the discussion of brachial plexus. Lumbar segment is not complex as such. We just in this brachial plexus we discuss the root, trunk, division, cords and branches. We have discussed root, 5 roots, and upper 2 united form your superior, and the 7 form the middle by a single one, and your inferior form by the 8 and T1. Each trunk divided into 2, interior and posterior, interior, posterior, and all the posterior unite to form posterior cord. The upper two interior form the lateral cord, and the lower interior form the medial cord. All these are relation with the axillary artery. So posterior cord is posterior to your axillary, lateral is lateral to the axillary artery, medial is the medial to it. And each one give from the posterior we have 2 nerves coming out. One is the axillary, one is the radial. Lateral give the major is the musculocutaneous, and the medial give the ulnar. And medial root from here, lateral root from here from the median nerve. This is actually formation of that. So just we have mnemonic, lot of mnemonic which will help you to point out. Just understand this. So easier. So here is actually your axillary artery. You can see posterior cord is posterior to that, lateral is lateral to that, medial is medial to that. Okay. So all the ventral rami of subinaural form in the network. That name is your brachial plexus. We have discussed. So the other thing we use the other question which is mostly a prefix brachial plexus and post mean. Pre mean before, post mean after. So we have segment C5. If the C4 is involved, we call them prefix in this plexus. If your post segment will be T2. So if T2 is involved, we call them postfix brachial plexus. Easier? So here is for example C4. Here is your T2. If C4 attaches with this, we call them prefix brachial plexus. What is postfix? If T2 is involved. But keep this concept clear. At a time, it could be a prefix or postfix. If C4 is connected, T2 will be absent. If T2 is present, C4 segment will not connected. Easier? So just mention in the definition 2 points. One is C4 is involved and T2 is absent. T2 is present, C4 is absent. Just this is definition of your prefix, brachial plexus and postfix. Easier? So now come to the tricky way, and we have discussed the branches, lot of branches which help you understand. So draw 3 by 2 like this, other is in the opposite direction. So easier. So and draw 2E. One is right here, other right here. Easier, and make like this. It acts like. Okay, so just mention. So here is your 5 roots: C5, C6, C7, C8, and your T1. Because we have 8 nerves, spinal nerves, but 7 vertebra. So easy. So superior is superior, middle, and just label it. Inferior, trunk. And here is interior posterior division, interior posterior division. Here is posterior interior. So you can see here lateral is formed by the upper two, and your posterior formed by the all 3 posterior. One is here, one is here, one is here, and the medial is formed by the only last one, interior. Okay, so these are cards, and these are your nerves, musculocutaneous. Here is your axillary, and here is your radial, and here is your ulnar is here, and medial, which is formed by the lateral and the medial. Is it? Enjoy this. So, and this is your axillary artery relation of that. So, root, trunk, division, cards, and the branches. So, just label it. It's when if a question comes, you have to draw. It's easier way to draw. Draw 2y and 1y leg and form 2e, and just practice one or two times. You will be easier. So, ventral match. So, same segment. Just I'm adding some more points. So. Now coming to the mnemonics and the other branches, adding more and more stuff, because we have layers of concept. When we cover the first layer of concept, then go to the next. So let's see, we have roots, trunk, division. So some student confused to these 5 segments. So trick is root, DCD, ABCD. Just follow. So come in the opposite end. DCD, root D. R represent your root, T represent trunk, G represent division, C represent cards, D represent branches. So opposite A, B, C, D, you can just follow. So go opposite D, C, D. Okay, root. So this is mnemonic. So other thing that we need to discuss, which is our location of that. Your actually root come from your actually paravertebral region. So and your the trunk move. You have sacral muscle in the neck, so they move in between the 2 sacral muscle. So that location of trunk, and division come on the clavicle region. So on the posterior aspect, cards you move it, they are associated with the axillary region, and branches go into the your arm or brachia. You can see. So mnemonic is pick AP. P represent what? P represent your paravertebral region. I represent intersacral between 2 sacral muscle. And C represent clavicle, posterior to your clavicle, and A represent axillary region, and D represent brachia. Okay, so this is location. If I ask what is location, just follow this. Pick AB. P represent paravertebral, that location of root, intersacral location of trunk, and your clavicle, posterior to clavicle is your division, and axillary, which is your cards, and the brachia is the branches. Axillary artery and the cards relation asked in any type of exam, in Viva or SAQs or the PG exam, that is really important. You must need to know the cards. Other are someone asked or maybe not, but cards location always discussed. They are in relation with your axillary artery. Okay, so now this segment. So these are C5, C6, 7, 8, 0, superior, middle, inferior, your cards, interior posterior division, and the lateral posterior medial cards which are associated with your axillary artery. So here, now come to the other thing, that is your the nerves, branches. We have discussed this. The trick is MAM rule. Just follow the MAM rule. What say MAM rule? MAM rule explain later, because we have to know the major branches and other segment in their root value. So MAM rule will help us. This is just a mnemonic. No, it's not an actual rule. So MAM rule. M represent actually your musculocutaneous. A represent axillary, and other M represent your. So just follow. M represent musculocutaneous. A represent axillary, and M represent the medial, and R represent radial. U represent ulnar. So this is actually other question, which is name the major branches in lateral to medial direction. So this main rule is actually lateral medial. Musculocutaneous is most lateral, and then the axillary, then the median, then the radial, then the ulnar. So just follow this. This is lateral to medial. Okay. So now the other segment is the root value. Root value actually. So you have answer. So root value 32452. 32452. This is actually root. So just mention C5, C6. If you can see C6, C7, and C8, T1. So you can practice it later. I'm not a removal valve. So rule is 32452. C5, C6, C7, C8, and T1. So you can practice. If you can see, it's good. Otherwise, you can see later. So these three. So what is the root?
C5,
C6, C7. This is your first time. C5, C6, C7. And the last two. First cover this segment, then go to that. So what is root value?
C6,
C5 and
C5,
and C6. So this is root value axillary. Okay. Now the other is 4. What is root value?
C6, C7, C8, T1.
Same. And the radial 5, all 5. Then segment 5. C5 to 8 and T1, all are involved. Okay. Now ulnar, last two. What is the root? C8 and T1. One more time. Come like C. Follow the end. First C5, C6, 7, and then 2. 3, 2, 4, 5, 2. 3, 2, 4, 5, 2. So last three. First cover this. 5, 6, 7. Main rule easier. C5, C6, C7, and the last two, that is your axillary. Okay, and your median, these 4 fingers, and the all 5, radial, and your ulnar, last two. Okay, so this is really tested. Actually, there is no reason it's coming from here. So these root will be actually some segment go to some nerve, some are not taken by the nerve. So there is no shortcut for that. Easier is just mnemonic. If you follow the main rule, that is 3 to 4, 5. So other question, I have studied a couple of books. Some books mention the root value of these, the median and the radial, all nerves. Here is also mentioned 5. So you follow your own textbook, which is reference book actually. So then you follow 3 to 5, 5, 2. Okay, so otherwise it's okay. 3 to 4, 5, 2. Easier. Now come to the other segment. That is, I have mentioned already in the start of lecture. This lecture, if you follow, your 50% job is done. So then I am drawing the nerves, the other heading, in such a way that will help you to understand your throughout the nerves. So from first we discuss because the shoulder region, where we discuss the back and the interior, then the rotator cuff muscle. So just see, I am starting from medial. So when you follow the medial, you have rhomboid major, rhomboid minor, and levator sacral. So that
lower part of trapezius.
trapezius is actually supplied by the spinal nerve segment. So medial, in the inner layer, because we have superficial layer and deep. On the deep, you are actually these 3 are present. So trapezius is your spinal. No, don't confuse this. So first and this segment. So this is your dorsal scapular nerve that actually supply. So the root value is C5 easier. It's coming from here. So this is your rhomboid, major and minor, and levator scapular. So they are supplied by this. Now come forward. When you follow bigger, trapezius is covered. Trapezius is supplied by your spinal nerve, and the other is your rotator cuff muscle. So in the rotator cuff, your supraspinatus, infraspinatus, and your teres minor and your subscapular. So for the supraspinatus, it is suprascapular. supraspinatus, suprasaccular region. So the root value is C5-6, both are involved, you can see. Other nerve that comes if you move forward, you have clavicle. So other muscle which is under the clavicle, that is your subclavius muscle. So nerve is your subclavius. So root value is C5, C6. Easier? So other nerve, if you come forward, you have this serratus anterior muscle. That is your punching muscle. When you punch someone, this is your actually the flexion and extension. Okay. When you further use this, that is actually action by your interior, serratus anterior. That is your punching muscle. So the nerve which is coming from C5, C6, C7. So this is a long thoracic nerve. Okay. So long thoracic, which is going to supply your serratus anterior. That is your punching muscle. So root value is C5, C6, C7. Okay. You should practice one time this and before sit in the exam. Okay. Now come to there are some branches at the root level. There are branches at the trunk level. We have no more branches at the division. Now come to the lateral and the cards level. We have pectoralis major, pectoralis minor. We have covered the serratus anterior supply. Come to the pectoralis major and the minor. So this supply is actually the lateral cord and that is C5, C6, 7. So because all are involved here, so 7 is coming right here. So and other branch that is medial pectoralis. Because when you discuss the pectoralis major, we have two parts. One is coming from sternum, other is coming from the clavicle. So one is separated by actually the lateral part, one is separated by medial. So major concept is that the lateral pectoral and the medial pectoral supplying your pectoralis muscle. Major supplied by both, when the minor is supplied by only the medial pectoral. You will see, maybe it's not mentioned here, so but it's supplied for, as the name reveals, pectoral. So for the pectoral is major and minor muscle. Easier? So the other thing, at the posterior we have three branches: upper, middle and lower. Upper, middle and lower. So these are actually subsaccular. So that was your supra. Now coming to the subsaccular, because we have subsaccular muscle. Fossa, because subsaccular fossa is present. So the nerve is actually upper and lower go to your subsaccular muscle. And medial move forward and form your thoracodorsal. Thoracodorsal is your latissimus dorsi, longest muscle of your body. So come to this. So upper is for subsaccular muscle, thoracodorsal for latissimus dorsi, and your lower is for the teres major as well as for the subsaccular who mentioned both upper and lower. Easier? So this is actually all the nerves of the thoracic, the interior thoracic and the posterior thoracoappendicular region has been covered. So the other thing, which is a cutaneous segment, one is for the arm region, one is for the forearm. So here are actually your cutaneous coming from your medial part. Medial cutaneous, one is that root value is C8 and T1 because coming from here. So one is your for arm, one is for your forearm. So this is sensory for the sensory supply. So this segment is I think about. The next the few words I am mentioning, you should before the exam you should repeat this word. Coming to this, I am sharing the short story of all the nerves. Coming from the musculocutaneous, for your first, that is very short nerve, that is your axillary artery. I call it ATM card. The reason is that actually the A represent axillary, T represent teres minor, okay, and T2 represent deltoid. Only two muscles of axillary supply. One is your ATM TM, teres minor, that is your rotator cuff muscle. Other is your deltoid muscle.
Deltoid muscle is also a rotator cuff muscle.
No, rotator cuff are only four. That is on this. They are actually help out, but the rotator cuff is actually attached with your humerus like this. Okay, so ATM card, short story, very short story. TM teres minor, D represent your deltoid. Come to the other four now, and like this, just follow this. On the back of the extensor, this is flexor. because this compound flexor means when you shorten your length, because this angle is short, so this is flexion. Extension means increase, so when angle is increase, so this angle is increase, this is short, so this is flexion. So this is your flexor compartment. When you see this is your extensor compartment. Extensor is easier, radial for the arm, for the forearm, for here. So that is your radial. Remaining one are the what? The median, ulnar, and your musculocutaneous. Musculocutaneous right here in the arm. Okay? Musculocutaneous. Median right here. Ulnar right here. Musculocutaneous, median, and your ulnar. And there is exception. Exception, my other help out point. Exception 1. Exception 1.5, 1.5. Follow. Just see. One is your brachioradialis, which is not supplied by the musculocutaneous. That is supplied by radial. When you come to the here in the forearm, you will see 1.5. One complete muscle, that is your flexor carpi ulnaris for the ulnar side. And that is supplied because the ulnar side is supplied by the ulnar. And other is your profunda. That is 2 because we have 4. 2 of them, I think, maybe confused. But I think profunda is, which has actually have 4. Actually, tendon 2 are supplied by ulnar, 2 are median. So 1.5. Okay. So if you come to the exception 1.5 rule here. So because when you follow the radial is here, ulnar is here. So this side is supplied by your ulnar. And this side, that is your later part, supplied by median. Median 1.5. One complete group, that is your thenar group. Thenar muscle, abductor, opponents. So 3 muscles there actually. Abductor, opponents there, and the other is flexor, pollicis. So these 3 pollicis mean one complete group. Half is your lumbricals. Half lumbricals are supplied by your median. So later. So one more time. Brachioradialis exception, flexor carpi ulnaris, and other is your half of profunda. I think profundal longus maybe you digitorum profunda. So half of them there because 4 digits. They are going 2 are supplied by actually this, and for the ulnar that is your 1.5 thenar complete group and 2 lumbrical. This is complete story of your nerve supply. So now come to the other segment. I'm not going to detail of that, but just mention. So if the injury is right here, we call them the herpes palsy. If the superior trunk is injured. So if you superior trunk is injured, this nerve will be affected. This will be affected. This is not going to the your ulnar. So when your herpes palsy is affected, your ulnar function will be okay. Okay, so if you follow, because ulnar is coming from C8 and T1. Okay, so if superior trunk is injured, these 4 segments will be affected. If this segment is affected, your all will be affected except musculocutaneous, because this is going here, this is going here and here, and this segment is also affecting your median. But this is not going to the musculocutaneous. So when at low trunk injury or inferior, so your musculocutaneous will be safe. When your superior is injured, your ulnar will be safe. Okay. So all the function mean if you look at the musculocutaneous effect, your flexor will be affected. This function will be the flexion at the shoulder or they will be affected. And the auxiliary mean your teres, rotator cuff will be affected, deltoid will be affected. So you will see all these things. So they actually come like this. Because they have greater tip type, so like this. So their hand will be attached with body. So this is herpes palsy. Other is we call them the Klumpke's palsy. Okay. So other which is here and third which is going to the affected is your long thoracic. So if this is affected, what will be have winging also through, because this is serratus in their punching muscle. So normally in this position, when they try to touch somebody, you will see their medial side of your scapula will come out. We call them the winging of scapula. So a lot of detail. I'm just showing the short story that is in. If the posterior cord is affected, so you will call it actually wrist drop, or because your radial is affected because radial is going on the back of your extensor compartment. So, for example, if the extension not occur, mean like this, so wrist drop, and other your deltoid will be the deltoid palsy will be also shown, and the sensory supply also affected, and the teres minor function will be affected. So, in short, if this is injured, so that is actually deltoid, and if the radial is affected, your extensor is again. So actually the radial we also use the Saturday palsy because they are actually when they come right here, they are come on more subcutaneous. So when especially on the Saturday night, they sit like on the chair, so they actually sit like this, like this. When they sit like this, so what do you see? Their radial nerve is at this point, moving right here. So sleeping like this after a long time, their radial will be affected. So this is actually called the radial nerve because radial is more superior. Okay. No, we call them the Saturday palsy if the radial is affected. Now come to this musculocutaneous is affected, so we call them the your elbow flex will be affected because this is muscle is actually and the difficult sensory supply also often which is supplied to musculocutaneous. The other is your median, so that is your actually median color. So actually both the ulnar and the median color some look like similar. They are not, but you must need to know median. If the median is affected, means your thenar and the two lumbrical are affected. And if the ulnar column, means this ulnar is affected, so your these lumbricals are affected. So one is associated with flexion problem, other is extension problem. So they are look like this. So we will see the detail of that later. So this is actually shows all the segments of your. So we have covered the nerve supply. We have covered the throughout the story. So just see the pictures. Story is over. So you can see app hand on your claw hand. You can see here a wrist drop, and here you can see Saturday palsy condition, which is a radial nerve. And here is air palsy. You can see brachial plexus injured here. So disabled arm and move like this, and is like this. So this is arm palsy. Here is your column case palsy, resting of your forearm muscle, because their flexion and nerve supply is not coming. And claw head like this. So these are actually centered up. So if you follow the location, you can see the paravertebral region here, and the intersuckling is muscle actually present just here. So your trunk are moving here, and you can see the division. They are just back of the clavicle, and in the axillary region, your three cords are present. Okay, so this is actually axillary region. When you see here, this is actually axillary region. So then the branches come in the brachial region. So same thing makes a root, trunk, division, cords, branches. So if you follow the ventral rim, so actually there are dorsal root and there are dorsal with the sensory and ventral with your motor. So this motor unite one spinal arm, and then they divide into dorsal rami and the ventral. Ventral form the flex, dorsal go back and supply the back of your body. So this is actually, so same thing is mentioned. So you can see it later. So this is actually also which we have covered. So you can read it later. So you can see medial pectoral supply both, and your the lateral pectoral supply the only this. So here is complete detail of that. I am not going to make it. Just I am highlighting this. So this is musculocutaneous origin is mentioned here. Course is supplied here, and the sensory supply lateral forearm, and the motor supply your the interior compartment of your arm, musculocutaneous. So bicep, brachioradialis is not split by this. Okay, and the nerve injury. So injuries are protected by bulk of bicep muscle. So and stay bound to be upper bone. So if the like this. So and the sensory if the injuries occur, so sensory loss and the motor effect will be shown, and the deformed wasting of your bicep because the nerve is slower motor neuron type of injury. So if you follow the X-ray, you are saying they are coming from posterior division of superior and posterior cord, and then if you follow the course, they are actually shorter than in the posterior compartment or and wraps around the surgical neck of humerus. So actually, when you discuss the humerus, also I will explain later, but shortcut for you will use it humerus arm. At the surgical neck, your X-ray is affected. At the mid of knee shaft, your dentate level, your R, mean radial is affected. At the lower superior condyle region, supracondyle I think. So that is your M, medial. X-ray is right here, radial is at the dentate.
Common injury site is neck or
The surgical neck and dentate, tuberosity and your supracondyle. So R follow just A at the surgical neck, radial right here, and your median is at the lower. It's a lot of detail I'm not going into. So you know better ATM card, dentate and your teres minor. So and your common injuries. So stab wounds are everywhere common. So fracture of your surgical neck of humerus and the compression by shoulder dislocation or pressure. So like the X-ray is not associated, so that is included. So sensory and motor, so and your deformity deltoid distance. If you follow the radial coming posterior division of your posterior cord and the here is course dimension superior group is moved around the superior group and sensory your radial on the your extension side. So lower posterior forearm, your hand, and the motor supply, posterior compartment, everything is there, so you can read it. And the deformity is the wrist drop because the extension is not occurring. So if you follow the median, so you can see sensory thinner and thinner only 1.5. So and the lateral 2/3 of this is sensory actually, and the all the anterior compartment muscle only 1.5. So this is actually thinner group. Lateral 2 lumbricals, opponents thinner. These are 3 thinner group muscle, and this is your lateral 2 lumbrical. Opponents abductor and flexor pollicis. So here is actually the injury site and last motor defect and of benediction like this. And here is last story of your ulnar, that is interior from coming the interior division of your the inferior trunk or medial cord. So sensory supply. So and other is your motor. So major one is your motor, and here is actually muscle which is supplied by your ulnar. So the hypothenar, introitious, medial to lumbrical, and the adductor pollicis. So sensory, and the deformity is your claw hand. So this is actually summary of that. So we just end up this session here. Thank you very much.